Good afternoon, respected panel. My study was comparison of choroidal thickness in preeclamptic, healthy pregnant and non-pregnant females by optical coherence tomography. So preeclampsia is a multifactorial multisystemic disorder occurring approximately in 5 to 10% of pregnant women worldwide. It causes various organ dysfunctions including the visual system. High vascularity with poor autoregulatory mechanism makes our choroid particularly sensitive to hemodynamic alterations in preeclampsia. Thus, assessing this choroidal thickness may be used as a predictive marker in preeclampsia. So there were a very few prospective comparative studies in preeclamptic women, and there was a very lacuna in the literature. So the purpose of our study was to measure and compare choroidal thickness in preeclamptic patients, healthy pregnant women, and age-matched healthy non-pregnant women, and to evaluate any correlation between the subfoveal choroidal thickness, mean arterial pressure in the preeclamptic group. So we recruited 30 each in the three groups: 30 healthy pregnant, 30 preeclampsia, and 30 age-matched healthy non-pregnant controls. So total 90 subjects were taken. The study duration was 12 months. The inclusion criteria was women within age group of 20 to 40, less than 4 childbirths, best corrected visual acuity of 6/9 or better, and OCT images with a good signal strength of more than 7/10. And exclusion criteria was refractive error or IOP, which was not normal, any recent ocular history or systemic history. So after detailed ocular systemic obstetric history, we took detailed ocular examination and measurement of choroidal thickness by SD-OCT in the EDI mode, enhanced depth imaging, and the measurement of mean arterial pressure. And lab investigations, urine protein was taken in preeclamptic patients. So in this image, there is a representative photograph of each group, A, B and C. So this was the subfoveal thickness, 1500 microns nasal and also 1500 microns temporal was taken manually and recorded. So A shows preeclamptic women, B is healthy pregnant and C is healthy non-pregnant age-matched control. So after the comparison of ocular, obstetric, systemic parameters and also of the choroidal thickness between the groups, which was taken as subfoveal, nasal, temporal and average in both the eyes, right and left. The summary was that there was no significant difference in terms of IOP, central corneal thickness and axial length between the three groups. That is, all the three groups were comparable. No significant difference in the gestational age, gravida status and estimated fetal weight between the healthy pregnant and the preeclamptic group as well. The significant difference between three groups was in the mean arterial pressure and the body mass index, because it was highest in the preeclampsia group. Healthy pregnant group has the highest choroidal thickness, followed by the healthy non-pregnant, and the preeclampsia group in my study had the thinnest choroid. So this difference was statistically significant in all the three groups across the nasal, temporal, subfoveal average in both the eyes, except for the nasal choroidal thickness in the right eye. The correlation between the mean arterial pressure and the choroidal thickness was found to be inversely related. The correlation was statistically significant in all groups combined, but was insignificant for any single group separately, the mean arterial pressure. So our current study showed significantly less choroidal thickness in preeclamptic patients as compared to healthy pregnant and non-pregnant women, suggesting that increased choroidal vasospasm in preeclampsia. However, no significant correlation was found between the choroidal thickness and the mean arterial pressure. So this implicates that the choroidal thinning is governed by multifactorial choroidal vasospasm and endothelial dysfunction, systemic dysfunction, and not solely attributed to the mean arterial pressure. So these are the other studies, which are, none of the studies are from India. So there was a difference in the literature. In a few studies, there was a increase in choroidal thickness in preeclampsia, on the contrary to our studies. What was different here? They took severe preeclampsia groups, which had retinopathy changes. But in our study, we took preeclampsia without any retinopathy changes. So choroidal thickness can can be used as a novel biomarker in preeclampsia patients as an adjunct to other parameters. And future prospective comparative studies should be taken at a larger scale for better understanding of choroidal changes in preeclampsia. Our study is also now published in the Indian Journal of Ophthalmology. Thank you. I would also like to add the limitations of my study. One was we did not have spectralis OCT, we had a spectral domain OCT, so we used the EDI mode. And also we did all the measurements manually using the caliper. And a future study with a larger group will be needed. Thank you so much.
It's a very good and interesting study. Just want to have a discussion of sort.
Yes.
We all know that in pre-eclampsia, actually the blood flow to all the parts of the body increases as compared to a normal pregnant. Is it so?
Sir, in healthy pregnant, according to the literature.
Vascularity किसमें बढ़ेगी? Pregnant, healthy pregnant में सर आप या pre-eclampsia?
Sir, in studies in healthy pregnant.
No, I'm talking theoretically.
Theoretically, sir.
Theoretically, in pre-eclampsia, the blood flow should increase.
No, sir. In preeclampsia, there is abnormal placentation. Because of this abnormal placentation, there is systemic vasospasm. So there is choroidal ischemia. Whether and in healthy pregnant, there is increase in blood flow. So this is in accordance to my results that in healthy pregnant, the choroidal thickness is increasing. And in preeclampsia, the choroidal thickness.
There are two things. One is the thickness of the choroid, and one is the flow of blood. What I want to just, I am also not very clear about it.
Yes.
But what I wanted to know if we can measure the choroidal vascular index.
Yes, sir. There are
by
studies.
octa.
Yes, sir.
To know the exact blood, does the blood flow also decreases or increases?
In studies and literature, it
Thickness
has
will
been
decreases.
described that choroidal vascular index has also been described. It decreases because
Decreases in
of
preeclampsia.
systemic vasospasm. And as choroid is the most vascular organ of our part,
It is the best part to assess because
it
it's
is
the
the
most
best part
vascular.
for any systemic disease. So we wanted to correlate.
Great.
So just a curious question.
Yes.
How much prolonged vasospasm do you think should result into decrease in thickness? Because this is just for a transient period.
Yes.
Eclampsia is only transient.
Yes.
So actually what happens is all the ischemic changes, most of the ischemic changes in these patients is reversible.
Yes.
Within 6 weeks everything is gone. Isn't it?
Yes.
That also in sustained eclampsia, not pre-eclampsia.
Yes.
So why would there be? Because there is just focal vasospasm.
Ma'am, even in when I was recruiting subjects, so in some preeclamptic patients, there were also neurosensory detachments which we excluded. So even in preeclampsia patients, acute vasospasm causes neurosensory detachments and retinopathy changes before developing eclampsia. In preeclampsia group itself, it is caused because of
here the line is very fine. We are talking about PIH or pre-eclampsia.
only preeclampsia.
That is what I am saying. Because this is a very fine line. PIH is a precursor to pre-eclampsia.
Retinal vessels have a quality of auto-regulation, which choroidal vessels do lack.
Yes, sir. This is exactly the point of my study, that choroid is having
Maybe in the
a
next
poor
attempt, if you can work
auto-regulatory
on
mechanism.
octa and choroidal vascular index,
Yes.
probably the flow is you can measure.
Thank you.
But very good.